the grid view. Let me change it here for a second. I forgot I'm not the host of this chat, so I cannot do that. All right. All right, but you guys see me, or at least you guys can hear me. So the very thing that I loved, I fell in love with trichology was polarized microscopy. My father taught me about polarized microscopy about many years ago. When I first got certified 27 years ago. So being back to the roots of what I was taught in trichology is something that really got my attention. And when someone told me that the Italian Academy of Hair Microscopy was doing something about polarized microscopy, I said, I need to go there. And so I went to the School of Trichology in Florence, and I said, you know what? I'm doing the next course. So I got
What you
there,
doing, babe?
and really it was something above and beyond. And
Okay,
one of the
let me check with
reasons,
them.
okay, guys, one thing I would like for everybody to do is if you can turn your mics into mute, that would be wonderful. So we can all stay connected. And of course, we will open the mics later on so we can everybody join the conversation. All right. I really appreciate that. Thank you. So going back again, so when I went and did the course, my head was blown away and then some. And the reason is many of us are involved in the trichology industry. Some of you are doctors in your own field, and some of you do either hair transplant surgery or dermatology, or are involved in the hair loss industry. So having a polarized microscopy is a very essential tool for detection and um, for doing a consultation, particularly if you want to differentiate truly among many types of hair loss. Polarized microscopy really gives you an edge. And let me tell you a little bit on it. And I know Martina, Gianluigi, and of course, Andrea are going to be talking about this. I'm going to be presenting them later on, but I wanted to share my experience about polarized microscopy because it really is a tool that gives you um, a how we say a value to what actually is androgenetic alopecia. And that's something that really blew my head off because usually we know about biopsies, right? And biopsies are an excellent tool and they provide with a great deal of information, but unfortunately, it's very subjective, is not very objective. And when you have objective data, when you have values, when you have follicular depth values, and you can use that value to actually know if the follicles are actually miniaturizing, that that, my friends, it really is valuable to our practice. That really changes whether someone actually needs to use minoxidil, finasteride, spironolactone to treat their androgenetic alopecia, or if they're actually going through something that may look very similar, maybe a type of telogen effluvium, maybe a hypertrichia, maybe a low local estrogen alopecia. So there are many things that we might be missing without polarized microscopy. So before I continue, I want to bring my friend Kimberly Jenkins. Kimberly, you there?
I'm
I have to, you have to talk. So I want you to tell our audience, to tell our friends, what brought you to polarized microscopy, and what has changed over there at Bauman Medical.
So what brought me into polarized microscopy was the fact that it was something new. I had never heard of it. We've all done trichoscopy, right? But that's about sometimes as far as we get. So with microscopy with polarized light, it was definitely something new, and I was very intrigued about it. The ratios between adhesion, catagen, telogen, antigen, catagen, intelligent, and being able to, people. Especially here, I see a lot of patients day to day, and a lot of times they'll come in and they're like, "Oh, I'm having a shed right now," but being able to use polarized light with microscopy to actual say, "Okay, well, you're not in a shed at this moment," and being able to just kind of better help patients understand what's really going on. It's been a blessing, definitely. And then the fact that trichoscopy is only going to show you so much, right? Because we get to see the scalp one way with trichoscopy. But when you actually get to extract the hairs with microscopy and put them under the slide, and if you have the time to, I remember like a week ago, there was a patient that came in, she was having some issues with her hair. So I was like, okay, really quick. I had the microscope in the room, really quick. Let me just extract a few hairs. I wasn't trying to do it on the basis of trying to see, how many antigen, catagen, or telogen hairs, but to understand what was going on with her actual hair fibers. So there's so many different ways that you can utilize polarized light in your clinic. Like it's unbelievable. And I think it's a great asset. It takes a minute to get it, but once you get it, it's amazing. So that's my spill.
Excellent. Thank you, Kimberly. Thank you. Wow, we have an amazing group of people and it's getting larger. All right, this is excellent. So, without further ado, let's introduce the people who are actually teaching us to do this and the people who are basically responsible. The Italian Academy Hair Microscopy. I give you Dr. Martina Candido, Dr. Gianluigi Antonini, and Dr. Andrea Bani. How you guys are doing?
Very good. Thank you, Sergio. Thank you for helping us hosting this webinar. But we couldn't think about someone like more perfect than you to help us in this. So thanks a lot for your variability, and thanks, Kim, for your how to say, for your testimonials maybe about microscopy and polarized light. We prepared, actually Gianluigi did, I just translated a presentation for you today to help you better understand what microscopy can do for you in your daily clinic, and how we as a team can help you and give as much more information we can today. Gianluigi Antonini is there. Ciao Gigi, puoi dire ciao? Look at him. Gianluigi, dici solo ciao, saluta.
Ha il microfono disattivato.
Gigi ha il microfono disattivato.
Eccomi,
Okay,
mi
so
sento.
introduce you Gianluigi Antonini, Dr. Gianluigi Antonini, and Andrea Vanni. And let's start. What do you think, Sergio?
Yes, excellent. Let's get this party started. I know everybody's anxious. I know everybody is like, okay, what this is polarized microscopy thing, and how can I get my hands on it? So, wait for the presentation. It's amazing.
Okay, can you please confirm, Sergio, if you see the presentation?
Yes, I do.
That's right.
I think everybody does.
Okay, so first of all, I want to introduce a little bit of what is polarized light microscopy. So many years ago here in Italy, and here in Italy is very common the use of microscopy in polarized light during clinicals. We found out, going around into congresses and, speaking with other professionals that was we was actually surprised that no one outside of Italy was knowing this very I don't want to say easy, but is simple. But everything becomes simple after we is trained. So we was very surprised that no one was using it. So that's why we decided to start this journey on teaching people outside of Italy and in Italy this technique, which will help you on using the analytic part of the trichology. And why is it so important, the analytic part? Because it's not an opinion. Many times, whenever we go on a doctor, whenever we go on the dermatologist, whenever we go on a trichologist, the patient feel that the professionist is giving an opinion on what they see. And sometimes this can lead to misconceptions, can lead to low level of trust. With microscopy in polarized light, with analytic part, with numbers, this is absolutely converted in trust, in understanding, and especially in seeing on images what is going on. Who we are, Dr. Gianluigi Antonini, an international trainer in polarized light microscopy with decades of experience. I don't know, Gigi, how a 20 years old man can have all these years of experience, but yet, you know. Me, Martina Candido, I am biotech specialized in trichological science. So I put in my career in everything with beyond science and everything that talk about hair, scalp and hair. And Dr. Andrea Vanni, Executive Officer of C3, Hair Society of Science Restoration, and actually the one that make everything happen. So without Andrea, we wouldn't be here right now talking and speaking about anything. First of all, the I.A.H.M, which is the Italian Academy of Hair Microscopy, is an organization that started to do courses in 2023, but we have a history behind us that it's very particularly long. C3, the Italian Society of Hair Science and Restoration, actually was born in 1996, and in 2018, Trico Italia was, a sister of the C3 Society. For us, it's important to mention all the three societies that are actually binded together, because it's important for us to express that we are a structured organization, and in the organization there are doctors, dermatologists, chemists, and all the people that really are experts in every field we actually touch. And this is important to introduce it, especially when we will talk about the School of Trichology, the International School of Trichology. And it's important for us as well to express and to let you know that we are expanding. We are actually expanding in different countries. 2027, I don't want to do any spoiler, but we will go in the other side of the world. But right now, we are present in US. We did the first course in Fort Lauderdale, North America, so in Canada, Caribbean and South America. We went in Puerto Rico and Brazil, and we're wild, but I can't actually. It's not that I don't want, because I would like to spoil everything, but I can't. So stay tuned for the future locations. What we will talk about today, what is important for us to let you know. First of all, how this method, it's a revolutionary diagnostic power, give you a revolutionary diagnostic power, because it's going to remove many doubts that during our daily practice we can have. It's a practical daily application, so it's something that once you learn on doing it, it's something that will become will be included in every, or this is what we advise in every consultation. Actually is going to give to the patient the certain that they are going to the best professional, or actually to the most expert professional, because what you are going to show them, it's something that nobody can. And is very important professional advancement, because it's going to give you an opportunity to look at what you study from a totally another point of view. It's going to give you the point of view of the internal structure. It's going to give you the opportunity to observe the whole bulb, the anchor system, internal and external sheath, and now we will see how it's going to help you directly with the one-by-one consultation with your patient. We can't talk about what it is, microscopy in polarized light, if we don't start with the instrument. So how do we perform the analysis? It's important that we introduce to you the instrument, which is a microscope with the different filters. And this is an important information for us to give you, because When you enroll to the school or when you enroll to the microscopy infrared light course, we actually take the enrollment many months in advance. Why? Because we need to have a custom-made microscope just for you, just for the class, and that's why we close all the participation possibility 3 months before the course, because 3 months is the period of time that we need to be able to make the instrument produced for you and to be shipped on the location that we do the course. It's a very sophisticated technology that reveals structural details invisible to standard microscopy. That's why microscopy infrared light is giving us many other point of views directly on the hair structure and hair bulb. It's important to know that this is a have three ocular. Why? Two are for our eyes. The other one is to have an output. So we will be able to put or the smartphone or a camera, a regular camera, to be able to actually export all the images from the instrument to a TV, to a computer, however, whatever you like. So every image that you see, it's actually visible from the patient. It is important while you see the image and the image is reproduced on, let's say, a TV, that you comment and that you give information about what you see. This is what maintain the consultation very active, very interactive, actually, and will help you on making the patient exactly understand what is going on his scalp and hair. So what do we do with the analysis? What we can see with the microscope infrared light. So first of all, it's important to say that we are going to have a complete looks on the hair. Here we see the roots of the hair. We see that it's an anagen phase. Here the hair started is the point of the bridge. So there is no polarization because here is not keratinized yet. Then start the keratinization, internal sheath, external sheath, and the ostium, so the exit, the output, the exact part in which the hair go out from the scalp. And all this part is actually giving us many different information. We are going to analyze the cortex and cuticles, revealing if there are some damages. Follicular depth, we can calculate the depth, so how deep is this hair follicle, so we can predict if the hair follicle is rising up, so it's going through miniaturization, because what is the androgenetic alopecia? The androgenetic alopecia is not a hair that is falling out. It's a hair that is becoming miniaturized all the time until it will not grow anymore. So it's important the depth of the hair follicle to actually say to our patients if there is the androgenetic alopecia or if there will be, because sometimes we have some patients that started an hair loss journey and we see some hair reducing the depth. So it's important to have this information at early time. The bulb morphology, so we are going to understand if the shape of the bulb is normal or not, if the internal and external sheaths are present, and if they are present, if they have the healthy shapes and the sheath conditions. So to understand if the sheaths are partial or complete or totally absent. If the sheaths are not present, we need always to remember that the anchor system is compromised. So this is the only way for us to understand if the anchor system is compromised, analyzing it with microscopy and fluorescent light. When we do the hair shaft analysis, we are going to understand if there are damages, like here. You see here, this is a hair that is totally damaged. Those are the fiber completely out. Here the same, until here there is the hair, normal hair, and then start, you see all the damage. Normally those are chemical damage because we are on the shaft here, not inside of the bulb at the moment. If there are genetic condition, like for example, monilethrics or any other genetic condition, if there are nodes, genetic condition as well, or if there are breakage or traumas. For example, this is a trauma of a person that too often use the flight iron. And in these particular cases, here the flight iron was used with the hair still wet. So what happens when there is water inside of the hair shaft that isn't supposed to be there, and you use a very high temperature, the water transform in gas. And then with the flight iron, in a moment in which there is water, is going to create a little micro explosion. With the vapor, as well, all the fibers. You see that here is a very beautiful thick hair, but in a certain times is like internally exploded. And those are all things we can actually analyze in microscopy in polarized light. It's important to have a keratin competence assessment. What does it mean, keratin competence? Competence, it means not just the diameter of the hair, but the thick hair. What quantity of keratin is actually having? Is a thick hair but empty inside, or is a thick hair but full of keratin inside? And those are ways, there are these techniques, it help us to understand if the keratinic competence of the hair is still good, or if we have something that we need to work on. This is important because, especially with hair treatment, it's important for us to show before and after. It's important for ourselves to understand if a particular treatment is working for this particular client. So it's a very scientific method to actually check all the improvement of a hair. It's going to help us on recognizing the loss of isoelectric point with protein degradation, if there is a loss of elasticity, revealing structural weakness, if there is an increased fragility of the hair, that will predict the breakage risk of, or why there is a non-responsiveness to cosmetic. So we are going to understand how the structure is reacting to whatever treatment or, treatment plan we are actually having. It is important to have a comparative keratin analysis. So, for example, this is a very healthy hair. Here in the middle, there is a different polarization color. So, the blue is disappearing and is giving the place to the green. This is a hair with an excessive keratinization, while here there is a complete reduced keratinic competence. Why? The color disappear, we have holes, and here we have thick hair that don't supposed to be yellow as the thin hair, but should have many keratinic hair. Of course, all these details are going to be explained in the 3-day intensive course. How do we perform the exam? First of all, we are going to take the extraction point, and we are going to do a bulb and sheath analysis protocol. The extraction is going to be between 15 and 20 hairs. The location is the exact location in which there are changes in the DHT production, and this spot is the worst spot on the scalp. And that's why we do the analysis always in the worst spot. We prepare the slide, we start to observe what we put it on the slide. We start the documentation and an analysis of what we see. And the most important things, we have a real-time patient education, because you are going to explain, look, here you have this situation, this damage, you have the shape of the hair bulb that is not correct. You have the compromisation in the anchor system. And this is starting actually the conviction, the certainty in the patient to be in the right place. Because this is one of the most difficult things for us, for trichologists, is to explain, not to explain, is to make sure that the patient is sure to be in the right place. So what we are gonna do with the microscope in parallel light? First of all, trichogram analysis, so precise phase distribution assessment. So we are going to calculate the percentage of anagen, catagen, and telogen. We are going to do the qualitative trichogram evaluation. So it's not how many anagen, catagen, and telogen you have, but what is the quality of your future anagens, catagen, and telogen? Because one of the most difficult things is not looking at the patient and telling them what is the situation today. Because an expert trichologist, it's able to do this. But what's the future? How we can be sure of the future of this patient? Thanks to the analysis of the microscopy polarized light with the qualitative trichogram evaluation to understand if the pre-miniaturization started or to calculate the pre-miniaturization. So it means hair that are going to thinning, but they are still in the position to be treated. Diameter measurement, so we're going to measure all the diameter of the hairs to calculate the percentage of mass loss. They always say, I used to have the ponytail like that, now my ponytail is very thick. Okay, let's quantify it. So what is the percentage, the mass loss percentage? We are going to do the follicular depth measurement again to understand if an androgenetic started or if we are in the presence just of hypotrichia, which means low diameter. So low diameter but didn't raise up. So it's not androgenetic, but is low local estrogen deficiency alopecia. Psychosomatic evaluation, we can identify stress markers in hair structure. We can identify if there is a lack of sleep, if there is a particular stressful moment. Follicular ostium region analysis, so we will be able to understand if this person have a good hygiene, if there are sebum cups, if there are corneous cup, or if there are guests, so Demodex. Shaft assessments, we are be able to actually understand the health of the shaft. The most important things, guys, especially in 2025, approaching in 2026, it is the follow-up. We worldwide share the same problem. We can be the best in advertisement, the best trichologist, and we can have many people that do the first visit. Hundreds. How many of them will do the second visit? Most of them. The third, the fourth. It's worldwide counted that 4 appointment is as much as we can maintain the client in big percentage. Here in Italy, we follow people from 15 years, 10 years, 8 years, twice a year. They come twice a year for many, many years. Why? Because we train them. They come to understand where they're at. They come to understand how they can continuously prevent or improve or maintain, because we stabilize, because the word stabilization is not easy to explain to a trichology person if we don't show them numbers. If we don't explain them the stabilization, it's a big success. We don't need to look always to improvement and come to us for improvement. So this is very important, this follow-up tracking, because we are going to give you every 6 months answers, and they're going to see perfectly and clearly what is their trichological history. Because remember, a patient is not is not an episode. When someone comes to us that having hair loss sometimes, most of the time, is not a singular episode. This episode is put in a bigger story of the trichological history of the patient. So we need to be able to track their story and to help them in long term. Otherwise, they will go to people that with the magic potions, doing, some trick is going to convince them to spend a lot of money without result. And, we don't want that for our patient, absolutely. Another very important application is the surgical application. So prepare with pre and post transplant assessment, prepare the patient to reach the moment of the hair transplant in the ideal way. It's important to diagnose the telogen effluvium, or to confirm the absence of the telogen effluvium, or to confirm that the telogen effluvium, the sheds, just finished. And thanks to all the number that we take out from the microscopy and infrared light exam, we will be able to do that, actually, to do all the confirmation. Because all the people will come in our office saying, I have hair loss, I'm losing my hair. We will be able to tell them if this is true, so if it's yes, you are actually in this moment losing your hair, or to say no, you are not losing your hair today, but this is a process of many, many years. So the situation you have today is started X years ago. Even the chronic telogen effluvium is important to be recognized, because the chronic telogen effluvium have other characteristics, like for example, the compromisation of the anchor system. And that's why the hair have some difficulties to remain anchored to the scalp, even on very, very good quality of anagens. We can check the androgenetic alopecia. For example, here we see a miniaturized hair. So a hair that is so tiny, so little, to be directly in the slide. So imagine if this can be visible, of course, with the video dermatoscopy. The video dermatoscopy will not see this hair because it's too little. And understand if a process started. For example, see the diameter of this hair. Without doing any calculation, we can see that something started, because this is thick hair. This is thinner and this is thinner. So we need to show to the patient, look, this is your ideal hair, your good hair, but look at the others. They are going worse. So we need to stop this process. If we can, reverse this process, but if we can't, even just stopping is already a success. Otherwise, all this thick hair will become naturally, because the process just started, thin like that. And we don't want that. Even just showing that, the patient immediately have another image in their mind, which is not, I want to improve, is I don't want to go worse. If we are able to explain this to them, we got them, and we will have them for many, many years. Female pattern hair loss analysis. The female pattern hair loss analysis is not the same of the male pattern hair loss analysis. Why? Because the miniaturization, what we call miniaturization in female, is very rare. What we have in female is the hair that still is very, very deep in the hair bulb, so in the dermis. So the depth of the shaft, the sheath, sorry, it's very deep, but there the thinning started, and here is actually the same. Here we have a very thick hair, thinner, and this is very, very thin. So this is a process that started in a female pattern kind of hair loss. So here, the quality of the hair is very important, and the percentage of mass loss to be able to help those clients. What is actually the section of our course that immediately it's very exciting for our students? When we reach to this part, all our students start to pull out their hair to see what they have actually on the slide. Because the squalene and lactic acid assessment, so how squalene and lactic acid are present into the hair, are going to give us many different information, as of lack of sleep, or particularly stressful moment, or a person that is an overthinker. You know, those people that come to us and are like constantly thinking about their problems, their issues, or their emotional stress, etc. And those are people that produce stress hormones, produce cortisol, produce adrenaline, produce noradrenaline, all the stress hormones that are actually going to develop into the hair follicle lactic acid. They will have a corrosive action on the sheath. Now, this is a healthy hair, beautiful bulb, very thick hair, all the polarization color, and this is a present of lactic acid, but is a physiologic, so just a little. Look at this, you can see all the differences. Here we don't have the internal sheath, don't have the external sheath, you see this is supposed to be the same. But we have the hair surrounded by this brownish liquid, let's say, which is lactic acid and squalene especially. By showing that, we are showing that the hair roots is attacked by the production of the stress hormone. So they start to understand why they have this situation on their head, on their hair. Thanks to that, we are going to express and help them, not just psychologically, but even socially, emotionally. We're going to tell them that they need and help. If they don't sleep, and the lack of melatonin is a very big problem for hair loss, they need to get help. They need to sleep, okay? And all of this is possible with microscopy and polarized light. Not also, the lactic acid is actually able to create, unfortunately, to cause fried hair, frayed, I don't never remember the right pronunciation. Fried. Anyway, we call these
Maybe fried.
fried. Sergio, do you confirm it's fried?
Sergio, help me.
My Spanish kicks in, so I say fried. Kimberly can assess us better with the English pronunciation.
Che non è
Fried.
fritti, eh?
Fried, exactly, fried. All right.
Thank you for your patience, all of you. Fried. And what does it mean? It means imagine the hair like a banana. And when we peel off a banana, there is this part of the banana actually coming off from the structure. And this is actually what it means. So all of these fiber that are actually going out from the hair, and we are still into the hair follicle. Exactly like a chemical attack.
Wait, Martina, do you mean frayed? The
Frayed.
hair, it's
It's
frayed.
frayed. It's
Frayed,
frayed.
Yeah, frayed.
Thank you, Kim. Frayed. I'll never learn it.
Frayed and fried, two different things.
I love fried too, but this is another topic.
Exactly. Thank you.
So basically, it's actually the fiber going out from the structure. Now, another worldwide difficulties that we all share whenever we are, wherever we are, is the trichological puzzle. We sometimes have the opportunity to recognize a part of what we see or to give a diagnosis result. But we miss sometimes, often I will say, we miss the overlapping. Because sometimes what happens? If I see, for example, an alopecia areata, I go there, I see alopecia areata, I do the diagnosis of alopecia areata, and then I manage the alopecia areata. What about the other hair? Sometimes in our practice, we tend to go as better as we can to the result or to the diagnosis, but we can skip many things. So the puzzle, the trichological puzzle is absolutely important because we can have a normal telogen effluvium, acute or chronic, a telogen effluvium on a person that have androgenetic alopecia, so overlapping condition, telogen effluvium and hypotrichosis or hypotrichia, so telogen effluvium and thinning or with reduced density, androgenetic alopecia and hypotrichosis, so with the mass loss, complex presentation with hypotrichosis, androgenetic alopecia and scarring, or telogen effluvium, androgenetic alopecia and hypotrichia. So all of these combined situations need to be recognized by us, and if we don't use a method, it's very difficult to do on daily basis on all the clients. We can be lucky to recognize something on some people, but not on all. So it's important to have a method for the client. So why? Because if I have a telogen effluvium, For example, androgenetic alopecia person and a scarring, let's say, I need to explain them that the results are three different results. So on the telogen effluvium is that the stop sheds. On the androgenetic alopecia is to stabilize the situation, trying to reverse it to make the hair thicker, to work on the density. On scarring is to don't have it to continue. Because a person that have, for example, a scarring alopecia, androgenetic alopecia, and hypotrichia, when it see the patches, it's focused on the patches. And this is something that we will never make him happy, because on scarring, it will not grow. So why don't we take the opportunity to explain them that the situation are overlapping and we need to see it three different results? This is something that is our loss. We lose this opportunity. So it's very important to be focused on all the situations that can happen. Mastering microscopy, it means to understand the present, but especially the future assessment of the patient. We do trichograms, we do the miniaturization assessment with the percentage of miniaturized and pre-miniaturized, checking every 6 months that the numbers are going better and not worse, or if they are going worse, why, and give us the opportunity to change actually therapies to understand why is going worse. Mass loss calculation to understand the entity of the loss and understand the result that we can have at the end. By the way, always explain to the patient that the first 6 months at least, they don't need to be focused on results. They need to go do the therapies without looking at the mirror. They will look at the mirror, but in the sense that it's a very, very long process. In this way, we are going to predict a future evolution with a pre-miniaturization prognosis and with realistic recovery estimates. Remember that the therapist doesn't work on miniaturized hair. The miniaturized are miniaturized. The follicle is up. The follicle shrinks. The follicle is little. We can't work there. We will work on pre-miniaturized. We need to calculate the pre-miniaturization. If we calculate the pre-miniaturization, we will be able to give honest result. It is in the management of the trichological history that the ability to truly care for the patient client is exercised. It's very important to have the management of the patient, not just the 1 shot, 2 shots, 3 shots, because this is what happens worldwide. And by having the experience actually with many different countries and talk with many different professionals, that we know that in Italy we have the biggest and the longest follow-up period of time that in every other part of the world. And this is thanks to the analytic trichology that we use, that is not actually used outside of Italy. This is a slide that shows us that it's important to recognize where, in which part of the history, trichological history of the patient, we are actually tracking them at T0 to understand which kind of progress of algorithm we can think about our patient. And it is very, very important for us to explain this to the patient the first time. Sergio, I'm seeing a lot of questions coming, isn't it? No, okay, we are going at the end. Okay. The comparative analysis showcasing how polarized light microscopy reveals structural variation that guide personalized treatment protocols and predict treatment responsiveness. For me, it's very important to give a message today. Anytime we have a course, we ask to our students at the beginning what kind of question they have in their mind, when they talk about the patient. And many times their answer is, I think about which product can be better for my patient. I think about which shampoo, which lotions, which, any other product or any supplement can be good for my patient. At the end of the course, the question is reversed. The question is the opposite. What are the problem, the lacks of my patient, and then what kind of treatment I can put them in? Because if the question is not patient oriented, but is product oriented, we will never have big result with our client. And we will never have options because we can't think to have a client, a patient in our clinic and them to use for 3, 4, 5 years all the same product just because we carry those products. It's something that will not work for a long time. It's important to assess what they have, lack of vitamin D, lack of ferritin, iron, a lack of zinc, but not all the supplement all together. And what do we do in the future? So it's important to personalize all the treatment in at each single patient. Real world clinical impact, 95% diagnostic accuracy. Microscopy trained trichologists achieve significantly higher diagnostic precision compared to visual assessment alone. 3 times patient confidence. Patients show 3 times greater treatment compliance when diagnosis includes microscopical visual evidence. When we talk with them and we explain what's happening in their hair, they feel expert. They feel that they know what they have, and they are 3 times more likely to have a higher compliance in treatment. 78 outcome improvement. Treatment outcomes improve substantially when protocols are guided by microscopy analysis rather than estimation. Because with the microscopy polarized light, you are able to personalize in each single case the treatment. These metrics represent real outcomes from practices that have integrated polarized light microscopy. The transformation is measurable, significant, and immediate. I want to thank Sergio, Kim, and want to actually go in the explanation of what we do exactly. Because, many times we do presentations which are very scientific. We present the microscopy polarized light advantages, but then all the students write, okay, how do I do the course? Where do I come? How everything is organized, etc. So this time I directly put everything all together. But first of all, I would like to see and to answer to the questions. And then we go on the technical part. Sergio, can you help me on reading these?
Martina, we've been answering questions while you've been talking.
Oh my God, what a team. I'm
Efficiency,
so
efficiency.
efficient. Very, very good. Very, very good. Okay, so then I go home. Bye bye. See you tomorrow. No, I'm joking. In here I posted your big pretty face here. No, pretty face in bigger dimension for your testimonial. But you already gave us your testimonial before. But if you want to say something else, or I don't know.
No, I just want to say like some of for the class, right? One, I just want to reiterate the fact that you have to remember that it takes the company 3 months for them to make the microscope. So we have to order the microscopes way in advance in order to get them on time for class. The class in Boca is going to be in June. So about February, about end of February is pretty much going to be the cutoff for your microscope deposit. And also, let's get into some of the things also. So your payment for your class is given directly to I.A.H.M, right? And your microscope, if you take the class in Puerto Rico with Sergio, you'll purchase your microscope through Sergio. And if you take the class here in Boca, you'll purchase your microscope through us.
And let me explain why. The reason why is because Optica, which is a company that produces here in Europe, needs the microscope to be purchased by an American company to have the American warranty, and to a Puerto Rican company to have a South American warranty. So it's important that the company that buy from Optica the microscopes are local. And that's why we can't buy the microscope and sell it to you. Otherwise, the warranty will not be effective. That's the only reason why.
And then the second thing is when you take the class, once you purchase the microscope, I see someone ask, do you keep the microscope? Yes, after the class, the microscope is yours. You purchased it there during the class. You're going to learn how to set the microscope up and also how to break it back down. And after the class, then your microscope will be shipped to your address, and we ship it back to your city or state, wherever you are.
It's important to have microscopes in the location of the course because for 3 days you are going to practice with your own microscope. So there is 10 people, 10 microscopes, 20 people, 20 microscopes, because it's important that you do all the 3 days, all the practical part, focus on your personal microscope. See, she go directly straight to the point.
Se vuoi, Martina, io posso far vedere un attimo dove sto messo, qualche cosa.
See, okay, before to continue with the explanation of the course, for us it's important, but let me, 1 second, block here. And how to put Gianluigi as a big screen, Sergio, because Gianluigi wanted to show you the way that he is organized in his office with the
host, which I believe is Andrea, to change the view and point to a particular speaker. That way, Gianluigi's screen pops out.
Mi sentite?
Okay. C'è scritto.
Luigi, puoi condividere lo schermo se vuoi. Luigi can...
No, girò. Ah, ok.
E
Aspetta.
no, non deve condividere lo schermo, Andre.
Ah, ok.
No, se no, io giro solo la telecamera. Dopo che mi sono presentato, giro la
allora
telecamera
aspetta,
e faccio vedere.
Aspetta, vai.
Ok, bene.
Ok.
Vai, guarda la telecamera.
Ok. Hi, everybody. Hi, Sergio. Hi, Kim. I'm Gianluigi Antonini, a technician. In this moment, I in Dr. Agostinacchio ambulatory when I work. This is my microscope, colligate, yes, with the schermo. This is my glass.
This
This
is
is my software, and in this part there is the same image. In this way, I can speak about the doctor.
So as you can see, the way the location it's organized is that while Gianluigi is looking at the microscope, it's putting the images in his room and in the room where is, because he is right now the dermatology, with the working with the dermatology, in which the dermatologist is going to explain what Gianluigi is saying. So Gianluigi can talk in this room, explaining, and then the dermatologist collect and show in the other room in the other screen. So in this way, the patient perfectly understand and realize what is actually happening in his hair.
Ecco, quando parlavi appunto dell'ange sfrangiato, neanche a farlo apposta, eccolo qua.
This is a frayed hair. Now he is going to show us.
Aspettate che con una mano è difficile. Ecco.
Okay, So as you can see, we can actually defocus each single hair, or we can have the bigger image within almost all the hair on a slide. You see, this is actually a hair that is having a chemical corrosive action of lactic acid inside the hair follicle.
Ecco, loro devono immaginare il paziente seduto qua e quindi proiettate queste cose vengono spiegate in diretta, quindi la parte della miniaturizzazione, la parte dello sfrangiamento legato all'incidenza nervosa, e quindi è...
There is
Esatto.
of the hair that actually explain us the incidents related to the nervous area of this patient. So anxiety, overthinking, always being worried about something. This is how it's expressed in pictures. And of course, within the training, we are going to explain you exactly all the chemical mechanism and metabolic mechanism behind it.
Ovviamente questo non solo è un anagen con le caratteristiche dello sfrangiamento, ma è anche rispetto a questi altri, lo vediamo che è un anagen molto più piccolo e sottile, quindi è un pre-miniaturizzato caratterizzato anche da assottigliamento.
And of course, we can even just by a quick look see how it's different in diameter than the others. So how the diameter is completely different between those hair on this slide. And so we can explain to our patients that a process of thinning started. And then we are going to summarize and give them numbers on the situation he is in at the moment. Grazie, Gigi.
A te.
Thank you, Gigi.
Thank you so much.
Okay, let me share again the screen just to let you know, and thanks you for all the questions that I want to, I'm seeing, but I want to read with more focus later. The two courses that are right now already planned are Boca Raton, Florida. Thanks to Dr. Bowen and Kimberly for your welcoming, can I say? Yes, which is in English. The 3 days intensive training, and in Bayamon, Puerto Rico, in Spanish language, thanks to the hosting of Sergio in the University of Inter-America University Laboratory. We are in the biology laboratory there. Actually, I want to say that the Puerto Rico course is actually held both because I speak in English and Sergio translates, so I can say here English, Spanish. So if there is, for example, some date doesn't work for you in Boca Raton and you speak English, you are absolutely welcome in the one in Puerto Rico. Language is going to be Spanish, English. Sergio, you wanted to say this?
Exactly. You just said it. Okay.
Thank you, Sergio. Then another very important appointment with the I.A.H.M, it is in Italy, which is the School of Trichology in Florence. The dates are April 13 through 18. Is a 6 days comprehensive program. Is a school, a real school from 9 to 6. The faculty are going to be internationally renowned professionals, including dermatologists, chemists, biologists, specialized cosmetologists, microscopists, and microbiologists. It is important for us to tell you that the Florence School each year is 1 week in which there are the first 3 days that are basic for new people that come. The other 3 days are the advanced, and every year in the 3 days of the advanced we do new topics. So we imagine that our students come for the first time for the entire weeks. For all the other years in the future, they come for just the 3 days of updating of new content. Is a transformative educational retreat. How do we consider it a retreat? Because we are in the middle of the hills of Florence, in the middle of nowhere, in the beautiful land of Tuscany, in the beautiful, close to the Chianti area, but the landscapes and the place is absolutely magical. And it's going to be 1 week of real intense trichology retreat. It's important for us to let you know for this opportunity. We are always, and we will be always in the future, available for you for all the questions that you may have. And now, here are pictures about us around the world. Here we are at Bauman. Here we are in the university in Bayamon. Here Bauman as well. Here we are in Florence with Sergio, with Dr. Bauman. So with Kim, it's important for us to expand the words about our international school. Thank you. Thanks to all of you. Thanks to our students, so the people that already have been with us in the past. And thanks them for continuously, following us, continuously coming to our appointment. For us, it's a very, it's an honor, and it's honestly telling us that we are doing the same thing and inspire us every day. To our future students, future colleagues, thank you for considering the I.A.H.M as an association that can help you with the training. If you want to take the next step, here are all the information, the email and the phone for WhatsApp especially. Or if you are interested in a Boca course, there is Kim that is the one to contact, or Sergio if you're interested in Puerto Rico course. We don't want to take all of your time, but I just would like to show you real quick the brochure of the school, just to let you know very, very quick the topics that we organize for this year in Florence. Let me share the screen again. Okay, so the first 3 days, it's of course the basic one, so which even is not the real basic, but is the one for the first time that students come to us. So the anatomy, the physiology, where hair grows, inside the hair from the roots to the follicular metabolism, the duration of the hair cycle, the transition, and all the metabolic short circuits that can happen normally and during the alopecia areata expression, telogen effluvium, when hairs give up, causes, sign, and recovery. Estrogen deficiency hypotrichia, the other hormone metabolism that no one consider, alopecia areata, the mysterious and unpredictable. Tuesday, we are going to talk about telogen effluvium and alopecia areata compared, because there are many things that actually they have in common. Different kind of alopecia, so scarring alopecia, from doubt to diagnosis, recognizing what other confuses. So exactly, how to recognize exactly, precisely, and do a differentiation analysis. With the video dermatoscopy, it's not just magnification, but it's important to read what the hair tells. On Wednesday, we are going to talk about essential oil with the Professor Bini, that she's the one that actually are publishing books about essential oil with a ready-to-use method, and the cosmetic part with Professor Beatrice Marini, that is going to teach us the chemical part of cosmetology. And then this is the advanced part, so the continuous, the other 3 days of the week, from lab to the salon, the chemical-based hair treatment, complex kind of alopecias, from evidence to the future, targeted therapies for complex alopecias, real clinical cases, and step-by-step, so we're going to show you how doctors and trichologists in Italy, step-by-step, are going to treat scalp disease or hair disease. Patient management, this is very, very important. Simulation of a trichological consultation. A method ready to apply, documenting to grow. We need to produce images that speak for themselves. And we will teach you with an interactive afternoon. So all of us, we are going to teach you how to take the picture, what is important to put in the picture, how to include the microscopy picture related to the picture that you do with your regular camera, etc. Friday, we will have the Dr. Andrea Marleani with the trichological video dermatoscopy, a scalp map, patterns, markers, and key signals. We will do the practice, real clinical cases with the video dermatoscopy, Masterclass, see what determines the diagnosis and when the building blocks are missing, so to understand the nutritional deficiency and their impact on the hair. Saturday, we will have Dr. Ponziani, which is for all our students another superstar. All the students ask us when they are going to hear again Dr. Ponziani speaking with the microbiota. He published recently the microbiota related to trichology, and he's going actually to explain us, to guide us basically into the book. What is a skin microbiota? The future is now, emerging research and clinical application. And here again, the nutritional deficiency related to the microbiota in trichology. Of course, we are going to send you all the information, so just let us know which one you're more interested in. And please, if you have any question, I am going to be more than happy to help you, even if I have these two that I see typing, that I'm sure they already did all the job.
I want to, can you hear me, Martina?
Yes, we can hear you.
Yeah, I just want to let you know that in the next days, I will send you all the brochure with all the information and logistic information and cost about our courses of the school and the other two course of microscopy in polarized light in Boca Raton and in Puerto Rico, okay? So I have your email, and don't worry, we will provide you all the information before Christmas.
I have a question.
Yes, please.
Do you have to be a physician or a dermatologist to take the course, or just could you be a cosmetologist?
Yes, you definitely can be a cosmetologist. All the information that we are going to give are for specialists in trichology. So all people that want to learn, especially how to become an expert in trichology. So we start from zero information to very already very well trained trichologist. Thank you, Marianne.
You're welcome. Thank you.
Thank you.
Well, I would like to add something.
There is Lauren.
Yes.
Hi, how are you? It's good to see you again. Hi, Gigi. Hi, everybody.
Hi.
That's right.
When we decide to come back again, can we take all of these and have a review of the microscopy, or are we only going to be allowed to come for the advanced portion? Because I do want to return because I would like to have the rest of the education.
You are talking about the school in Florence?
Yes.
Yes. So normally you can apply for the advance. And in the past, if our students want to repeat the first 3 days, will be at no cost. There just will be the daily cost, which will be around 70, 80 euros per day for the cost, food, etc. But you will not pay again the first 3 days if you already took the last year. So absolutely, whoever already take the course and want to come to do the 1 week training again, you will just pay the advance course, the 3 days advance.
Okay. Thank you,
Lauren.
Okay. Thank you.
Thank you. Thanks a lot.
What I wanted to say is that if you have never taken the course with this wonderful group of people, you're missing out tremendously. So get yourself in there right now. Go to the School of Trichology in Florence. Get to the polarized microscopy class. These are 2 courses. And I'll say every time you can go, please do it again, because the information is so amazing above and beyond that it's incredible. And one of the things that I would like to say is that the people who are worried about the level of intensity of the course, if you're on level 0, this is a course for you. If you're on the top of the food chain, this course is for you because it adapts to all levels of understanding. And the more you refresh it, the more you learn from it. So I would say this is something that it must be done. If you truly care about your patients, if you truly care about hair loss, if you truly care about getting the best results, and of course being accurate, this is something that you must do.
Thank you, Sergio. Thank you for your kind
Thank you,
words.
Sergio.
is always, for us, a confirmation that what we are doing, it's something at higher level, which is what we are focused on, honestly. And another thing that I want to say is that in the past, the people that had problems on learning microscopy was not about the microscope itself, but was about some calculations. Because some calculation at the beginning we wanted to explain with regular math. From this year, and even for the students that I see here in a webinar with us, for example, Jennifer Micheli, I see. I don't see right now in this part anyone else. We are including the software in the next courses. So the
Lo sto
software
facendo vedere, Marti.
is going to be part of the course. It's going to be on us, the cost for the first year. And for the students that did already the microscopy course, that paid outside and they paid the software, we actually are gonna guaranteed 3 years of the plan included, so they are not gonna pay the 3 years to cover the price that they paid in the last courses, because we didn't want, that wasn't fair for people that bought the software in the past. With this deal with the company that was very helping us on doing this. And so for us, it's important to let you understand that whatever problems you have with us in terms of with the technique, we always try to solve them, and this is our way to solve the calculation part. So from now on, I think that there will gonna be no problem.
Ecco, lo sto facendo vedere, io
Okay,
intanto.
Luigi is showing the software. The software, it's very, very adaptive. You are going just to insert a few numbers and the calculation will be automatically done at the end. Yes, there is, this is absolutely we think that this is
Just give me 1 minute. Yeah.
the solution to the difficulties that some of the students had in the past.
È anche un'indicazione alla videodermatoscopia, perché dentro abbiamo delle immagini descritte, delle patologie con delle foto.
Is telling that the software is going to become our reminder, because there is an eye, so an information point in each part of the software that's going to remind us the theory. For example, seborrheic dermatitis. What it is seborrheic dermatitis? You click there and it's going to teach you and remind you psoriasis. What is psoriasis? And so it's not just a software, but all have the picture and the refresh part. So it's a tool in which we continuously do training, actually.
Thank you.
You're welcome.
I'm going to sign off. It was a very informative class. Thank you so much.
Thank you. Who is speaking? I don't see you though.
It's Marianne.
Oh, Marianne. Thank you, Marianne, for your attention. And we wait for you or in the US or in Puerto Rico or in Italy.
Well, you'll probably see me in Boca.
Okay. So then thank you.
And then in Italy.
Okay. We wait for you.
Thank you so much for your information. It was very helpful.
Thank you. Thanks a lot.
Thank you.
Any other information, please reach out to us and we will be more than happy to be available to respond to every question.
I look forward to getting the information in the mail.
Okay. Thank you, Marianne. Thanks a lot.
Well, have a wonderful day.
Thank you. You too. Okay. Here I see another question. The software will be included in the microscopy in Boca? Yes. The software will be included in the class? Yes. Would it be beneficial to do the School of Trichology in Florence and then do the Boca as a refresh? No, those are two different courses. So the School of Trichology is pure trichology. There is a section of microscopy, but theory is pure trichology with doctors that explain diseases, how to recognize them, and how to help you daily. The microscopy in polarized light, the 3-day intensive course, is a practice hands-on. Each of you will have their own microscope. There will be maximum 15 people because we are 3 professors and each of us is going to follow 5 students. So it's a ratio 1:5. Very, very hands-on, and we will be very present with you. So there are 2 different courses. You can do either way, or the psychology school before, and then the Boca, the microscopy and polarized light in Boca or Puerto Rico, or the opposite. So it's totally up to you. Oh, yes, Nehal, thank you. Online course will work good for us. I'm from India. I'm sorry, we don't do online courses because this is a very practical course and it's impossible for us to follow people that are not with us and that we can't see in the microscope with you. So no, at the moment, microscopy for sure is not going to be available online. Absolutely, it's impossible.
Okay, thank you for your reply. Thank you very much. But
Thank you.
yeah, we will. I'm eagerly waiting to join your classes, but hopefully we'll see how we can join your place.
Thank you.
Hopefully, it will be good if you start your courses in India too.
Why not? Absolutely. We are expanding. We will go in the other side of the world.
Yes, yes, yes. Oh, great. Yes, yes, yes. Understood. Already, we are working. I am a Ayurveda doctor, and we are working on in trichology. We are in Ayurveda, and totally we have 108 centers in all over India in different states. All
Absolutely.
are 10.
More
Yes,
than
and all our 108 centers we are working in trichology, and we have our diagnostic laboratory too.
okay. I think we can definitely talk about it, and we will be more than happy to come in India too.
Yes,
Thank
yes,
you.
surely.
Thank you.
And it was a very nice presentation and very informative too. So thank you for guiding us. Thank you very much.
Thanks a lot. Thank you.
Thanks.
Yes, yes.
And here there is. Do you think in the future polarized microscopy course will be held in Europe?
Maybe.
Very good question. We are working on it. So please send us an email that you are interested on doing the course in Europe. So we will put you on the list. We need minimum 10 students to organize the course in Europe. Once we have the 10 students in Europe, we will be more than happy to organize it. So, and spread the word. So if there are more people from Europe here that would like to do it in Europe, just let us know and we will be more than happy to organize, maybe in a, in a beautiful place. So we can go to Paris or we can go to Greece, or we can go close to the beach, We like we like to our motto is we need to work, but we need to enjoy life. Have fun and laugh. And we really love to actually build a family, to build a group of friends, and not professors and people that came to our courses. I think that can approve what I'm saying. So it's very important that we build a community, a big, strong community, because we always need help. We will always have these difficult cases, this difficult person, this difficult situation that we need to solve. We are all here to help people because whenever we talk about trichology, product, active ingredients, blah 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 blah, we're actually focused on helping people enter in a positive way in their life and help them to be more confident, help them to actually doesn't suffer anymore about their hair. And that's require a group of people, I think. That's my personal opinion.
Yes.
I want to say thank you again to Kimberly and Sergio to help us to organize this Zoom meeting. Thank you very much.
Thank you.
You are part of us.
By the way, there's a plus. There's a plus in the Puerto Rican class, and that is Andres going to be teaching salsa every night.
Yes, I'm going. I need to learn. I need to learn a little bit better, but I will try.
He has become a very good salsa dancer.
I have some months to improve.
I will be the one that try all the different food. Okay, thank you. Thanks everyone for your attention, and
Thank
we
you,
will
Sergio. Thank you,
more information.
Kim. This is not colleague, but the friends, the real friends. And questa è anche l'occasione, Martina, per fare gli auguri di buone feste a tutti voi e alle vostre famiglie.
This is a good occasion, Professor Gianluigi is saying, to wish you a Merry Christmas or wish you an end of the year and a Happy New Year, and enjoy your family time, enjoy free time, and be ready for the next year with the right energy and the right positive mindset, which is the best.
Ciao Vanessa. Ciao Vanessa.
Thank you.
Vanessa è stata una delle nostre prime conoscenze in Brasile.
Ciao.
Ciao Vanessa. Adesso è
Ciao,
Miami,
ciao.
vero? Ciao
Yes.
Vanessa.
For certo che sono nella turma di Pocaratone la prossima volta.
Okay.
Ottimo. Benissimo.
Imparando inglese.
Okay. We will teach you everything, even in Italian, no problem.
No, but understand in English, start a little bit. It's good.
Noi stiamo
Good.
sempre cercando di imparare il portoghese, ma ancora
Non è successo.
No.
Bate piano. Il salsa è già un grande punto. Imparare a danzare dopo impara a parlare portoghese. Bene.
Bene.
Va bene, ragazzi,
Allora.
buon vederci.
bye.
Everyone, have a good Christmas.
Thank you, you too.
Thank you for
Thank you.
good
Bye.
presentation.
Thank you.
Yeah, I see you.
Bye. Merry Christmas.
Bye
See
bye.
you.
Thank you, Sergio.
Bye.
Thank you, Kim, again.
Bye Jennifer. Ciao.
Ciao.